Hello, everyone, and welcome to our question lab. If you're stateside and you had the observance of Labor Day, we hope you had a great long weekend and are ready to get back to work. Tonight's topic for question lab is communications, and leading our session today, once again, is Dr. Paras Vakaria, and he's going to introduce himself now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident here in Dallas, Texas. I originally graduated from pharmacy school in Missouri, went back home to Michigan to do medical school, and I'm also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well, and I'm happy to help lead tonight's session.
Excellent, and we're happy to have you here as always. We also have some panelists joining us, Kate and Jeff, who you'll meet later, and one of our RX coaches, Brenda. Brenda, would you like to introduce yourself?
Sure, can you hear me?
We sure can.
Awesome. My name is Brenda. I'm a third-year medical student at Central Michigan University. I just wrote my Step 1 a few months ago, and I actually used a lot of the RX products like the QBank, Bricks, the coaching, and it made a huge difference in feeling prepared. So if anyone has any questions about it, you can message me directly or ask a question to the group, and I'll do my best to answer it.
As you can see here, the answer choices are covered up. That is by design. We do that because we don't want the answer choices to guide or dictate your thought process. And we don't want you to see an answer choice that you might be unfamiliar with, which may cause you to panic as you're trying to answer the question. So I've gone ahead and removed those answer choices for you here today. After that, we'd like to begin with the lead-in. The lead-in is the last sentence of the question itself. And we do that so that you know what this test writer is asking you prior to reading that vignette. That will allow you to pick up on all of those relevant clues and hopefully prevent you from having to reread that question and waste valuable time on test day. So let's go ahead and read that vignette. Which of the following responses to this patient most effectively uses motivational interviewing techniques? Which of the following responses to this patient most effectively uses motivational interviewing techniques? Once we read the lead-in or the last sentence, we'd like to ask our students how many steps they believe this question will require. And we do that so you can keep an organized thought process, make sure you're answering the right question and not skipping any steps. An example of a one-step question could be where you're asked for the diagnosis. An example of a two-step question could be where you're asked for the treatment for a diagnosis. And an example of a three-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So with that, I'll wait a few moments here for you to respond in the question box and let us know how many steps you think this question will require. And then we'll go ahead and move on and read that vignette. All right, I see some responses coming in. Let's go ahead and take a look at that vignette. A 39-year-old computer programmer comes to the outpatient clinic seeking help with his alcohol use disorder. He says that he used to be a regular drinker and drinking daily after his husband left him 6 months ago. He says he has approximately 10 drinks per day, most days of the week. He describes in detail the problems that drinking has caused him and his sincere desire to quit. Which of the following responses to this patient most effectively uses motivational interviewing techniques? I want all of you to start thinking about the clues in the lead-in and vignette as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. Okay, so starting off, generally the first thing they give you is demographics. And in this case, we're told this is a 39-year-old male. Okay, so always important to make note of that. Okay, now usually when they give you an occupation that early on, sometimes it can be relevant. So in this case, we thought it was important to highlight. Okay, with these types of questions, communication questions, you do want to make note of what kind of conversations have been had, What is the patient telling you? Because those are things that are going to go into a good response back to the patient, and that will help come up with a good answer choice, okay? So in this case, take note of the things that he said. Take note of those stressors, take note of that social history. And in the last sentence, it talks about his sincere desire to quit, okay? So you always want to take a look out for that, especially with substance use disorder. So then we get to the lead-in, and it asks us about the response that most effectively uses motivational interviewing techniques. So I think assessing steps might be a little bit tougher with these types of questions, these communication questions, but I think in general, we're going to want to come up with a good response to the patient. So that's going to be at least one step. I think we're then, you could maybe argue that which of those is most uses the principles of motivational interviewing, and that could maybe be another step. But I think in general, a lot of these are going to be one-step questions where we have to come up with a good response to the patient. So let's go ahead and take a look at those answer choices. And what we have here are 5 answer choices. You can see that they're pretty lengthy, and that's because these are responses that you would say to the patient in real life as well, okay? And so when we go through answer choices, if you've listened to us before, you know that we recommend starting at the bottom and working your way up to the top. So starting with answer choice E and working your way up to answer choice A. And the reason we recommend this is because a lot of times we'll see students who, they'll start at the top, they'll see something they like, and they'll select it without having gone through all the choices. And sometimes they'll end up getting that question wrong. So doing it this way prevents yourself from making that mistake and prevents yourself from biasing yourself. So we're going to go ahead and do that now. Answer choice E. Thanks for sharing that with me. What do you think might be good next steps to reduce your drinking? D. Thank you for sharing all of that with me. I'm glad you decided to stop drinking. Have you ever tried to stop drinking before? Answer choice C. It sounds like you have lots of great reasons to quit. I'm impressed you are so honest with yourself. What do you think your next steps will be? Answer choice B. I'm sorry that you're struggling with alcohol, but I'm happy to hear you're ready to quit. What are some problems that you think drinking has caused in your life? Answer choice A. Have you ever sought help for your drinking in the past? It sounds like this has been going on for a long time. So I know these are some pretty lengthy answer choices. We want to make sure that you guys get a good look at these answer choices, really digest them, think of what would be the appropriate response. So we're going to give you guys a few seconds, a little bit of time to look at these answer choices, okay? So we won't open the poll just yet. We'll leave this open, these answer choices, just so you can take a good second look at it.
All right, well, hopefully you've had a chance to read those choices again. I'm going to go ahead and open up that poll. We'll give all of you a few moments here to select your best response. Once again, we're going to wait until about 2/3 of you have responded. And we know there's a character limitation here, which is why we left that up on your screen for a few extra moments. Remember that there is no penalty for guessing on test day, and you should never leave a question blank. So if you're unsure tonight, don't worry. Take your best guess, and we'll go through all of the correct and incorrect answer choices here together in just a few moments. All right, well, let's take a look and see what you selected. It was close, but in first place, we had answer choice C. We had a tie for second place between B and D. So let's take a look and see what the correct answer is. And the correct answer is C. It sounds like you have lots of great reasons to quit. I am impressed you are so honest with yourself. What do you think your next steps will be? And 35% of you got it right, so great job. It was a challenging question, but I'm going to hand it off to Boris, and he's going to help us master this type of question. Boris.
Thank you, Sean. Yes, definitely a couple good, tough answer choices here. So let's see why answer choice C would be the best response. So we know that this patient is seeking help for alcohol use disorders. He's talked about the problems it has caused in his life. He also has a sincere desire to quit. Always important to assess in your patients. So the important thing here, and this is part of the reason that we recommend highlighting key phrases even in the lead-in, is that it asks about most effectively uses motivational interviewing techniques, okay? So motivational interviewing techniques. So let's go ahead, let's take a look at the next slide. Sean has gone ahead and pulled up a nice table from first aid that talks about motivational interviewing. And it's a counseling technique that helps facilitate behavior modification with nicotine dependence, alcohol use, obesity, okay? So you definitely want to ask the patient or have the patient explain to you how that behavior has interfered with their life, why they might want to change, okay? And you definitely want to assess a patient's readiness for change as well, okay? With motivational interviewing, you want to ask, and this is a good, these are good theories and principles for most patient questions, but you want to ask open-ended questions, not closed-ended questions. So a closed-ended question would be a question where the patient could give you a yes or no answer. So, are you looking to quit drinking? That would be a yes or no question. That's closed-ended. Why are you looking to quit drinking? Requires that the patient answer your question of why, and it's an open-ended question where they have to then go in detail. So those are generally better questions. You also want to show that you've been listening to the patient and that you've heard what they've said, and you want to provide affirmations, okay? So you want to let them know that you understand what they're going through, and you're thankful for them coming to you. So let's go back and look at our answer choices. So answer choice C validates that the patient has reasons to quit. It shows that you have been reflectively listening to the reasons that the alcohol has caused problems in his life. You're also affirming the patient, validating the patient. You're impressed that you were so honest with that the patient is so honest with himself. So you're validating and affirming that patient's beliefs. And now you're going to assess their readiness to quit. What do they want? What are they able to do next? What do you think your next steps will be? And it's an open-ended question. The patient will then further describe to you what their next steps could be. Some of the other answer choices, a lot of tough answer choices with these communication type questions. With answer choice E, it doesn't do a couple things. It doesn't summarize what the patient has shared with you. It doesn't show that you've comprehended the reasons and the problems that has caused in that patient's life. You definitely want to summarize that. Okay. Answer choice D. This doesn't end with an open-ended question. It's a closed-ended question. Have you ever tried to stop drinking before? Yes or no? In general, you do want to choose an answer choice with an open-ended question as opposed to a closed-ended question. Answer choice B. Again, this doesn't show that you have reflectively listened to the problems this has caused in his patient's life, okay? Because you're now asking what are some problems that you think drinking has caused in your life, but the patient has already described that in detail, okay? So that kind of doesn't go towards building patient rapport. And lastly, answer choice A. This doesn't affirm the patient's decision to quit. And it's, again, a closed-ended question. Have you ever sought help for drinking in the past? And again, it doesn't kind of summarize what you've learned from the patient, doesn't show that you've listened to them. So not as good of an answer choice. So answer choice C kind of meets a lot of those checkpoints for motivational interviewing. So that's why in this question, that would be the best appropriate response.
Excellent. Well, thank you, Paris. Once again, that was a challenging question. We are going to be seeing more communications questions on the exam coming up, so we thought it'd be good to do a question lab on it. So let's go ahead and move on to our second question on communications for the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following is the most appropriate next statement by the physician? Which of the following is the most appropriate next statement? Physician. I'll give all of you a few moments here. Let us know how many steps you think this require. Go ahead to that vignette. All right, I see the responses coming in, so let's go ahead to that vignette. A 24-year-old woman comes to the clinic for examination after her home pregnancy results are positive. She is accompanied by a man who claims to be her brother. He interrupts the interview to state that the patient wishes to terminate the pregnancy, be given long-acting contraception. The patient does not make eye contact with either the man or the physician. She does not engage in conversation with the man. In the history, she does not mention her relationship to him. The physician asks the man to leave the room before conducting the physical examination. The examination reveals several bruises on the patient's upper extremities. Which of the following is the most appropriate next statement by the physician?
Thank you, Sean. I will go ahead and kind of walk you guys through what some of the important clues in this vignette and the lead-in are. Okay. So again, now we have a 24-year-old woman, and so we definitely want to make note of that. They then tell us a few things, okay, and a lot of social history. There's some things here that are maybe concerning. There's some things here you definitely want to make note of, okay, especially with these communication questions, these ethics questions. You definitely want to take note of it and fully absorb it. You do not want to miss a clue, because any one of those clues in that vignette could be why one response is better than another response, okay? Now, it is important to note that the physician did ask the man to leave the room, okay? And there were some physical exam findings as well, okay? So now it asks about the most appropriate next statement. So I think, this is probably going to be a one-step question again. We just need to figure out a good response. But these one steps are a little bit difficult because we kind of have to go through all of the answer choices to figure out which is the best one. So it'll take a little bit more time. So we'll go ahead and do that now. Go ahead and take a look at those answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. So I'm going to start with answer choice E. Our discussion is completely confidential. How do you feel about the situation? Answer choice D. Our discussion is completely confidential. Do you feel safe with your brother? Answer choice C. Is your brother forcing you to engage in behavior you would rather not do? Answer choice B. I have a duty to report my concern that you are being exploited. Your behavior makes me concerned for your safety. Answer choice A. I'm concerned that you are being exploited or abused. Because you are an adult, I'm not duty-bound to report it. That is your decision to make. So once again, we're going to leave this here for a few seconds. Make sure you guys get good looks at those answer choices, okay? We'll leave this open for a little bit.
All right, well, hopefully you had enough time there to read those answer choices once again and get a visual. I'm going to go off that poll and give all of you a few seconds here to submit your responses. Once again, we're going to wait until about 2. Friendly reminder that we do have a raffle and a special offer for all of you in attendance. You stick around because you must be present to win. I see the responses coming in. We'll give all of you a few more moments here. All right, let's take a look and see what you selected. Looks like there was a clear favorite, and that was answer choice E, with 58% of you selecting that response. And in second place, we had answer choice D, and 23% of you selected that answer choice. Let's take a look and see what and the correct answer is E. Our discussion is completely confidential. How do you feel about this situation? So well done, everyone. Let me hand it off to Paris.
Thank you, Sean. So we're going to go ahead and show you what we think the reasons are that answer choice E is the best answer, okay? Obviously, some tough responses here, and you guys did a great job with this question. So let's go ahead and take a look at the vignette and the lead-in. So I don't know if you guys can hear me, sorry. But essentially in this question, there's a woman who is accompanied by a man. They just found out she is pregnant. The man is speaking on behalf of the woman and says she wishes to have an abortion and start using a long-acting contraceptive. The woman doesn't make eye contact, doesn't engage in conversation. It makes it difficult for the physician to ascertain if the patient's wishes are being expressed. Okay. If we're able to move to the PowerPoint slide, sorry, Sean, I'm not sure if you can hear me. The other thing here is the man is claiming to be her brother, okay? So it's possible that this patient has been coerced into attending this appointment, okay? So there's a few things. One, the physician should ask the man to leave the room, which he did. And then the physician should assure the patient of complete confidentiality, okay, which is what is said in answer choice E. Our discussion is completely confidential. And then he asked an open-ended question, okay? So the physician asked an open-ended question: how do you feel about the situation? That is not a yes or no question. That requires the patient to give a full response to that question. So that is the correct answer choice here. That's the best response in this situation. Answer choice D, 1, is not an open-ended question. It's a closed-ended question. And 2, it's assuming that that man is the brother, which may not be the case. Answer choice C also is assuming that the patient is the brother, which may not be the situation. And that is also a closed-ended question as well. And it also doesn't convey a sense of concern as well as the other answer choices as well. So answer choice B does correctly identify a concern for exploitation, but it's not true that the physician has a duty to report exploitation of an adult. That's for minors or for elderly. Okay. Answer choice A, this response is a little bit cold. It doesn't convey that concern or that empathy or compassion that you would want to convey to a patient. That is your decision to make. A little bit cold sounding, not what you would want to say to a patient in real life. Okay, so you again want to choose answer choices that show open-ended questions, convey confidentiality, and make sure the patient knows that. You also want to separate the patient from that potential person, which was done in this situation. So great job with this question. I will hand it back to you, Sean.
Excellent. Thank you, Paris. Yes, great job. That was a challenging question. A lot of you got it correct. So we've done 2 out of 4 questions on communications. We've got 2 left. And for those of you wondering what next week's topic is, that topic is neurology. So next week's topic is neurology. Before we move on to our 3rd question of the evening, I want to talk to you briefly about RX Coach. So RX Coach is our one-on-one coaching and tutoring program. And we've had a lot of success with it. We actually have a living testimonial here with us, which is one of our RX coaches who took our coaching program, did extremely well, and is now joining the RX coach family to help students just like you, to help on your journey to get to where she is, hopefully. So what do we do in coaching? Well, if you're still in school studying for a med school exam, we'll look at your syllabus and we'll make you a personalized study plan based on that and your learning style. And then we'll work with you to make sure you're understanding the content and you're ready for those block exams. If you're studying for a comprehensive exam, a shelf exam, or a USMLE or complex exam, we'll administer in one of our assessments. And then based on that assessment, we'll formulate for you a personalized study plan. And it's not always about, students always ask, how much time should I study? How long will it take me? Every student's really different. It's about how well you study, how efficiently you study, and the plan you have in place to make sure that you're learning the right subjects in the right order to build that foundation the right way and the most efficient way. And we hear that from students a lot, and they tell us, we got to where we wanted to go, but we actually got there sooner than expected. And that's been a common testimonial that we hear from our students at Coach. So in these coaching sessions, we will help to identify your knowledge gaps and bridge them. We'll work with you on your test taking skills, and then closer to test day, we'll work on your timing and stamina. We're one of the only coaching programs that was actually in medical education prior to becoming involved in the coaching sphere. So we've actually authored our own resources. Our founders wrote First Aid. They authored USMLE-Rx, which includes RX 360, which is comprised of RX Bricks, our question bank QMax, flash facts, as well as our express videos, all of which you will get with every tutoring package. So if you're interested in having the help and support of our certified and highly trained coaches, we encourage you to reach out to us at rx-coach or rx-coach.com. And you can click on that free consultation tab to talk about the program and how it can benefit you. All right, so if you want to talk about the program, see if it's a good fit for you, that consultation to discuss the program is completely free, and you can do that at rx-coach.com. So with that being said, let's go ahead and move on now to our third question of the evening. Remember that we do have a raffle at the end of tonight's session, and that next week's topic is neurology. Once again, the answer choices are covered up, and we will begin with the lead-in. After acknowledging the daughter's concern, which of the following is the most appropriate response by the physician? After acknowledging the daughter's concern, which of the following is the most appropriate response by the physician? I'll give all of you a few moments here to let us know in the question box how many steps you believe this question will require, and then we'll move on to the lead-in. All right. I see the responses coming in. Let's go ahead and take a look at that vignette. A 64-year-old man is diagnosed with colon cancer after undergoing colonoscopy and biopsy. He is of normal intelligence, but has avoided discussions about diagnosis, prognosis, and treatment with his physician. He has reluctantly made an appointment for the following week. The patient's daughter calls the physician because she is concerned about her father's inaction. After acknowledging the daughter's concern, which of the following is the most appropriate response by the physician? And with that, I'll hand it off to Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in the vignette and the lead-in. Okay. Now we're dealing with an elderly male, 64-year-old man. Okay, and he's diagnosed with colon cancer. So as we mentioned, there's a lot of important reasons to highlight these important clues in these communication questions. And also, it helps prepare you for the situation, because there are a lot of common situations that you are going to see on step one in regards to these communication questions, okay? And in this case, it's about a patient's daughter calling the physician about her father, okay? So hopefully a lot of you guys have come across this scenario and this situation, and that's why it's important to make note of those clues in the vignette. So then the lead-in is saying, well, after acknowledging the daughter's concern, what's the most appropriate response, or the most appropriate next response? So after acknowledging the daughter's concern, what's the most appropriate response? Okay. So again, probably one-step question here. What is the most appropriate response to the daughter? So we're going to go ahead and take a look at those answer choices. And again, we're going to have to go through all the answer choices and figure out which one would be the best or most appropriate response by the physician. Once again, we're going to start at the bottom. We're going to work our way up to the top. Answer choice E. Your father has an upcoming appointment next week. I would love for the three of us to talk about this together. D. Please have your father fill out the consent forms on our website and email or fax them so we can discuss this as soon as we get them. C. If your father is there, he can grant me verbal permission to talk with you about this now. B. I'm sorry, but as there's no way to prove you or his family over the phone, I can't share anything with you. And A. Family support is vital for patients like your father. I would love for the three of us to talk about this together at an appointment. So again, we're going to leave this up for a few seconds. Please make sure to go through these answer choices.
All right, well, hopefully you've had enough time to read those choices once again. I'm going to go ahead and launch that poll and give all of you a few moments here to respond and submit what you believe is the correct answer. And as always, we will go over the incorrect and correct answer choices afterwards. As you notice, we've done that with every question, and we encourage you to also do that while you're doing practice questions. Make sure you got the question right for the right reasons, and review those incorrect choices as well. I see the responses coming in. We'll give all of you a few more moments. All right. Well, let's take a look and see what you selected. Once again, there is a clear favorite, and that is answer choice A, and 55% of you selected that. In distant second place was answer choice C. So let's take a look and see what the correct answer is. And the correct answer choice is C, and 26% of you got it right. So definitely a challenging question. If your father is there, he can grant me verbal permission to talk with you about this now. And with that, once again, I'll hand it off to Paris.
Thank you, Sean. Yes, definitely a tough question. Okay, so let's take a look first, at this vignette again. This is a family member worried about her father and wants information as soon as possible so they can come up with an action plan. Okay, and this is not something that's benign. This is colon cancer. Okay, this is a malignant issue. Okay, so the important thing is, though, her concern does not supersede the right of the patient to keep, in this case, his medical information private. So if he wants his medical information private, that supersedes the daughter's concern. Okay. Now, if the father's consent can be obtained immediately, then you can address the family member's concern. Okay. It's always preferable to do consent in person. However, you can obtain consent over the phone or via telemedicine, okay, as long as certain conditions are met. And you would want to obtain identifiers to verify that is indeed the father, okay? So let's go ahead and take a look at the next slide. There are a couple nice tables in first aid that kind of go over this. So one is confidentiality, okay? So confidentiality respects the patient privacy and autonomy. Now, there are certain situations where if the patient is incapacitated or if it's emergent, where you may have to disclose information to family or friends, the patient can voluntarily waive the right to confidentiality as well, okay? And there are some other instances or exceptions to confidentiality. So potential harm to self or others, okay? Now, if we take a look at the bottom, there's in first aid, there are specific ethical scenarios that you may face. And this is actually one of those ethical scenarios that's listed. So a family member asks for information about the patient's prognosis. In general, you want to avoid discussing issues with relatives without the patient's permission. Okay, so you need that patient's permission to talk about it with this family member in this question. Okay, so let's go back to the other answer choices in case you selected those and maybe wanted those to be not as good answers. So answer choice E. This does a couple things. One, it's actually a HIPAA violation. It's saying that the patient has an upcoming appointment with me, specifically maybe I'm a GI physician next week, and you shouldn't necessarily reveal that the patient has an appointment with when that patient has an appointment. Okay. Furthermore, you maybe also don't want to push this, even if the patient had given consent. You maybe don't want to push this all the way to next week. This is something that can be addressed sooner, especially in the setting of colon cancer. Okay. Answer choice D. So while this could be appropriate, while you could have the father do consent forms and stuff, it's causing a little bit of unnecessary delay. Okay. When really in the same effect, you could just get verbal consent. Okay. It's a little bit cold as well. Okay. The response of just saying, have your father fill out consent forms, then we'll discuss, a little bit cold response. Okay. Answer choice B. This is actually not true. There are ways of asking simple verifying questions to confirm the identity of the father over the phone. And then he could then grant permission to the physician to speak to his daughter. So that's actually not true. Answer choice A. While this is a nice sentence, a nice phrase to tell the patient that family support is vital, pushing it off to talk about it at an appointment may not be necessary in the situation. There's no reason to wait for the family, to require the family member to wait until the next appointment. They're probably anxious and want to talk about their concerns over the phone. And if the father gives permission, you can do so. Okay. So although that's a nice statement, it kind of delays that conversation a little bit more than necessary. So in this question, answer choice C is the best response.
Boris, if you don't mind, we have a thematic question coming up here, which is how do we know that the person on the phone is in fact the father?
Great question. So in that case, this is kind of assuming some things that we are not being told during the question, but just assuming if I were a physician, I would have certain patient identifiers. I would have patient identifiers that normally fall under HIPAA. So when you or I were to call a physician's office, they ask us for some of that information, our name, date of birth, social security number, other types of identifiers that you could use to verify the patient's identity that would meet criteria for verifying identity over the phone or over telemedicine or over telehealth, televideo. Okay, so there are certain questions that you can ask the father once you get him on the phone to verify his identity. And if you are able to do that, if you are able to verify his identity, then you can go ahead and ask him permission about the daughter. So that would be your first step. You would want to verify that father is indeed the father based on information you have in your chart about his identifiers.
Excellent. Thank you, Boris. Great question, everyone. With that, let's go ahead and move on to our last question of the evening, and let's try to finish strong before we move on to our raffle and special offer. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following is the most appropriate follow-up statement by this physician? Which of the following is the most appropriate follow-up statement by this physician? Once again, I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require, and then we'll move on to the lead-in. We'll move on to the vignette, rather. All right, let's go ahead and move on to that vignette. A patient is given an antibiotic dose intended for another patient. The mistake is discovered immediately, and the physician speaks to the patient who received the errant dose. The physician tells the patient, "I am deeply sorry that you received a dose of antibiotics meant for another patient. I have verified that the medication is not on your allergy list and will not interact with your treatment. Which of the following is the most appropriate follow-up statement by this physician?" Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so this is our fourth time doing that. So hopefully you guys are starting to get a sense, especially in these communication questions, what is important to make note of, okay? Because there are going to be very subtle clues sometimes in the vignette that is going to help pick one response over another. And as we remember, if you guys remember with our first question, there may be clues in the lead-in, important phrases there, that are going to make one response maybe better than another response. Okay, so hopefully by doing this a few times, you guys are kind of picking up as well on what's important to make note of. So in this case, we're talking about a patient being given an antibiotic meant for another patient. So a patient safety issue, patient error issue, okay? So the physician tells the patient that quote, those two sentences, okay? You definitely want to read that and make sure you make note of that. So then it's asking what would be the appropriate follow-up statement to what the physician had told the patient, okay? So again, probably another one-step question here. What's the appropriate follow-up statement? But we are going to have to look at those answer choices and see what would be the best one. So let's go ahead and do that now. Let's take a look at those answer choices. And once again, I'm going to start at the bottom and I'm going to work my way up to the top. Answer choice E. One positive outcome of this situation is that you may be less likely to contract an infection while you are in the hospital. D. We will be having a staff meeting this week to discuss ways of preventing this type of error in the future. C. We have reported the incident and the responsible party to hospital administration. B. If it turns out that you do not have a drug reaction, we will make sure that you receive immediate care and are not charged for that care. Or sorry, if it turns out that you do have a drug reaction, we will make sure that you receive immediate care and are not charged for that care. Answer choice A. I will also talk to the patient for whom the medication was intended and apologize for this oversight. So once again, we're going to leave this up here for a few more seconds. Allow you guys to get a good second look at those answer choices.
Excellent. Hopefully that was enough time for you to take a look at those choices. I'm going to go ahead and open up that poll. Select the answer which you believe is most correct, and then we'll do the explanation and, of course, move on to our raffle. All right, I see the responses coming in. Looks pretty split so far. We'll give all of you a few more moments here. Once again, a friendly reminder that next week's topic is neurology. All right, let's take a look and see what you selected. It was close. 35% of you selected answer choice D, whereas 31% of you selected answer choice C. So let's take a look and see what the correct answer is. And the correct answer is answer choice D, and 35% of you got it right. We will be having a staff meeting this week to discuss ways of preventing this type of error in the future. And with that, I'll hand it off once again to Paris.
Thank you, Sean. Yes, great job, guys. So definitely another tough question here. So what's going on in this question? Well, a patient was given a medication prescribed to a different patient, okay? The physician has apologized, explained what happened, reassured the patient that this medication will not cause harm or interact with treatment. Okay. The physician should next explain what the staff at the hospital will do to prevent this mistake from happening in the future. Okay. Giving medication to the wrong patient, even if no harm is done, is a serious matter. And so the response should focus on preventing harm in the future. Okay. So let's take a look at the next slide. Again, another ethical scenario that is in first aid in the ethical scenarios table. Okay. So an invasive test is performed on the wrong patient, or in this case, a medication is given to the wrong patient. The physician is ethically obligated to inform a patient that a mistake has been made. And this physician in this situation did that to the patient. Okay. So if you are presented with a question about that, you are, as a physician, ethically obligated to inform that patient. On the next slide as well is another table in first aid that talks about analysis and how to analyze medical errors. Okay. So there's one that is retrospective and there's one that is forward-looking. In this case, we're looking at a retrospective approach. The event already happened. The failure event already happened. And now we want to go back, look back in time to see exactly how did this happen? Why was the medication given to the wrong patient? So we can prevent recurrence. And this is called a root cause analysis. Okay. The forward-looking approach is kind of looking in the future to say, let's identify ways that mistakes can be made and then fix them before they're even done. So in this case, you can see that the mistake already happened and now we're going back in time. So this is a root cause analysis. So when we go back to our question and we go back to the answer choices, basically that staff meeting is going to be looking at like a root cause analysis. We're going to discuss ways of how this happened and discuss ways of preventing it in the future. Okay. Let's take a look at the other answer choices. Answer choice E. This is an inappropriate statement and deflects the seriousness of the mistake. Okay. I don't think many people selected this, so great job there. Answer choice C, I think, was the second most highly selected answer choice. So this response does attempt to provide reassurance to the patient by stating that this has been reported to hospital administration. However, you could see there's a couple keywords. The responsible party has been reported to hospital administration. So that's kind of potentially putting blame on someone or some people, okay? And you don't want to make this punitive. You essentially want to find out why the mistake happened, discuss ways of preventing it, okay? So answer choice C is a little bit punitive. It may make the patient actually feel bad that someone is being punished. Answer choice B. This is kind of focusing on like a low probability reaction to a drug. It doesn't really provide reassurance to the patient about the mistake itself, okay? Answer choice A. So the error was discovered, it was corrected immediately, and that means the patient whom the medication was originally intended for actually didn't miss an antibiotic dose. And so kind of explaining that about the other patient is a little bit unnecessary. You don't need to go into talking about another patient's care to this patient in this question, okay? So kind of a little bit about outside the scope of what you would want to talk with this patient. So answer choice D is the best answer here. Definitely some tough communication questions. Hopefully you guys can realize that they do like to give you some tough choices, especially, two that are very, very tough to choose between, but hopefully these principles that we kind of went over today will help you choose the right one come test day. Back to you, Sean.
Well, thank you very much, Paris. Once again, we did have some challenging questions this evening. And we appreciate all of you being here. So with that, here are the question IDs. I know some of you had some additional questions about these questions, so you can simply type these QIDs into the RX search field. And these questions will come up so you can review them in more detail. I'll leave this up for a few moments here so you can Take a screenshot, a picture, or write these down.